Anyone can get breast cancer. Each year, about 5,000 women living in Finland are diagnosed with breast cancer. This means that every seventh woman gets breast cancer at some point of their life. More than half of the patients are over 50 years old. In Finland, all women between ages 50 and 69 are invited to a free breast X-ray called mammography examination approximately every 2 years. With mammography, it is possible to find breast cancer at a very early stage, which makes treating it easier. About 2/3 of breast cancer cases within this age group are found during screenings, and the rest by the person herself or by a healthcare professional. Attending to the screening mammography is very important to all women. You will receive an invitation letter in the mail, either electronically or in paper form. It shows the mammography time that is reserved for you. There is a phone number in the invitation letter that you can contact if you have any questions about the appointment. For example, if you want to change the time for your appointment, if you need to use a wheelchair, or if you prefer a female nurse to help you with the examination. The invitation letter also contains few questions about health. These questions should be answered in advance. You don't need to prepare in any other way, but you should put on clothes that can be removed easily. You must bring with you Kela card, passport, identity card, or driving license. You should reserve about half an hour for the whole appointment. Before the imaging, the radiology nurse goes through the questions on the invitation letter and a few additional questions. Important information is, for example, if your breasts have been previously operated on, if you know that a close family member has had a breast cancer, and when and where your previous breast X-rays have been taken. Don't worry if you can't answer all the questions. In the dressing room, you remove all the clothing from your upper body. There is no need to take off the headscarf. Jewelry is usually not a problem, but larger necklaces should be left at home. Imaging takes less than 5 minutes. The X-ray pictures are taken from both breasts from 2 directions. A total of 4 pictures are taken. In one picture, the device squeezes the breast for a few seconds, as it is important for the breast to remain as still as possible. Squeezing also makes different areas of the breast more visible in the image. The squeeze may feel uncomfortable, but the nurse always tries to pay close attention to the client so that the examination doesn't feel painful. After the imaging, you can get dressed and the examination is complete. You will receive the results in 3 weeks. The X-rays are viewed by 2 radiologists so that no important observations are missed. If one of them wants to do further examinations, you will be called within 3 weeks and invited to additional examinations, such as an ultrasound examination or another X-ray. Sometimes it may be necessary to take sample from the breast. You will receive another invitation to the next breast cancer screening in about 2 years. In addition to screening mammography, you should examine your own breasts every few weeks. First, look at your breast in good lighting through a mirror. Stand straight in front of the mirror, first with your hands down and then hands up. Check both sides of your breast. Remember to check under the breast as well. Squeeze the nipples gently to see if there's any discharge. Pay attention to the size and shape of the breast, changes in the skin and nipples, and notice possible one-sided discharge from the nipples. Then palpate both breasts lying on your back. Feel through the entire breast with a circulatory motion, fingers straight and joined together. Feel through the breast and sides 3 times, arm next to the body, extended straight to the side, and raised above the head. If you find any concerning changes in your breast, record and report your observations to a healthcare professional.